snippets. We all know that day and night, right and left, we use anesthetic equipments and how they need to be decontaminated and sterilized. So to deal with this topic, we have Dr. Navnesh Saban. You can.
Can you see me, Dr. Ankur?
Yes, ma'am, you are visible and you can make it full screen.
Can you see the presentation now?
Yes, ma'am. To all the delegates, thank you very much for your positive feedbacks. We are having a look at the chat box. It's very encouraging and motivating to us that you all are participating and you are putting so much of good feedbacks. We are sure that we will come up with more and more programs for you all in the future also. Thank you so much. Keep enjoying the rest of the program.
Thank you, Dr. Ankur and AIMS Guwahati for giving me this opportunity. I'm glad to see almost 500 participants who are attending this CME. So I'll be briefly sharing the regarding the decontamination of anesthetic equipments. So first we'll discuss the most common definitions. So cleaning it involves the removal of foreign material from an item. And when we talk about decontamination is the removal of microorganisms and unwanted material from contaminated materials or living tissue. Disinfection is the process which is capable of destroying most microorganisms, but as ordinarily used, not bacterial spores. If the process is able to remove bacterial spores also, then it is called as sterilization. And universal precautions you all must be aware of involves the use of protective barriers and workplace practices to reduce the risk of exposure to any body fluid that may contain contagious microorganisms. So Spalding gave a classification of the various equipments and divided the equipments into non-critical, semi-critical, and critical. So non-critical equipments are the equipments which come in contact with the intact skin of the patient. For example, stethoscope, BP apparatus. So all these things they come under non-critical. So for non-critical equipments, what we need to do is these require minimum low level or intermediate level disinfection. Second comes the semi-critical devices. So these are the devices which come in contact with the mucous membranes or non-intact skin. For example, our fiber optic bronchoscopes or the nasal speculums. So these devices, they require high level of disinfection. And third and most important is the critical devices. So these are devices which come under contact with the sterile areas of the body and as well as the vascular system. So these will involve all the equipments which are used during surgery, the surgical clamps, the forceps. So these will require the highest level of disinfection, that is the sterilization. So for different levels, we use different agents. For high level disinfection, we use ethylene oxide, peracetic acid, and all the kinds of aldehydes like butyraldehyde, formaldehyde. For intermediate level, we use kinds of alcohol, kinds of iodine, chloric disinfectants. And for low level, we use chlorhexidine and phenolic disinfectants. So first and foremost, we'll come to the face masks, which we use every day during our induction of anesthesia. So these, some of them are single patient used, while others can be sterilized. We generally, we are supposed to clean them with soap and water. We can even use a swab, and they can be also pasteurized. We can ETO them, autoclave them, or chemical sterilization also can be used. These are the airways, the Gudal airways and the nasopharyngeal airways. These are also either single patient used or sterilizable. Clean them with soap and water. Rubbered airways may be autoclaved. And pasteurization, chemical sterilization, ETO, plasma sterilization can be used for these airways. Next is the ET tubes. These are always single patient use. We should always remember this, and these should never be reused. Regarding laryngeal mask airways, these are various types which we use these days. These are mostly single patient used or can be sterilized. If we autoclave them, so maximum what we can do is we can use them 40 times by autoclaving. After that, they need to be discarded. Catheter mounts and angle pieces. These are again single patient use. However, some of them they have metal components. In olden days, we used to use them. So the ones with metal components can be autoclaved. Coming to the breathing circuits and pieces, these are also disposable. However, the ones which come with the machine, which are reusable, so they require high level of disinfection. Change them weekly. If you are using a new bacterial or viral filter each time with every patient, change them earlier if they are visibly contaminated or after infectious patient, and reusable tubes can be chemically disinfected. Bougies, these are airway adjuncts which we use for difficult intubation. So these either require high level disinfection or the ones available are meant for single use only. Coming to the stillets. So stillets are also either they are disposable or they might be sterilizable. So they can be autoclaved, ETO, plasma or chemical sterilization. Coming to the laryngoscopes. So laryngoscopes, we have to clean them based on what part we are using. So first and foremost, for the handle, so first remove the cells, and it can be either autoclaved or we can use a chemical disinfection. Coming to the blades, so blades may be sterilized with ETO, steam, plasma, or can be treated with liquid chemicals. Decontaminate with 0.5% bleaching solution if it is blood stained, and clean with detergent and water, and high level disinfection is required with glutaraldehyde 2%. The bulb, however, should be removed and cleaned with a spirit swab. Next is the flexible endoscopes or the fiber optic bronchoscopes. So their disinfection involves 5 steps. So first is clean, disinfect, rinse, dry, and store. So first step is cleaning. So for cleaning, wipe the external surface of the insertion cord with gauze. So this is the insertion cord.